Thank you for participating in this study. We're excited to share this video with you. Our goals are for you to learn a little bit about the epidemiology of sleep-related infant deaths, to learn about a new tool that will be embedded in the EMR called the Infant Sleep Assessment, and to learn some strategies for talking with families about keeping their babies safe when they're sleeping.
The Safe Start Project is an intervention trial testing an assessment of parents' infant sleep practices integrated into the electronic medical record, and a brief overview of motivational interviewing techniques for residents to use when talking to families about infant sleep practices. Each year, about 3,400 babies die suddenly and unexpectedly. These deaths are known as SUIDs, sudden unexplained infant deaths. There are three common types of SUIDs: sudden infant death syndrome, or SIDS, accidental suffocation and strangulation in bed, and unknown causes. 41% of SUIDs are from SIDS, 32% are from unknown causes, and 27% are from accidental suffocation and strangulation in bed. Both the SIDS and ASSB deaths are classified as such after an investigation. Deaths are classified as from unknown causes, either because a death investigation was not possible or did not yield any conclusive cause of death. The SUID rates between 1990 to 2020, noted by the purple line, are shown here along with each of those three common causes of sleep-related deaths. Generally, SUID rates declined considerably in the early 1990s after the release of the American Academy of Pediatrics Safe Sleep Recommendations in 1992, and the Back to Sleep campaign, which started in 1994, and which is now known as the Safe to Sleep campaign. This stacked bar chart shows SUID rates by cause and by race, ethnicity in the United States from 2015 through 2019. SUID rates were highest among non-Hispanic American Indian Alaska Native infants, non-Hispanic Black infants, and non-Hispanic Native Hawaiian other Pacific Islander infants.
Here in Maryland, sleep-related infant deaths are a big problem as well, and more specifically in Baltimore City, with a disproportionate rate compared to other areas across the state. Sadly, we have had some families in the Harriet Lane Clinic who have suffered a loss from sleep-related infant deaths over the years.
With colleagues from the Johns Hopkins Center for Injury Research and Policy, Dr. Solomon has been researching solutions to infant sleep-related deaths. From 2015 to 2019, they tested a health educator intervention to improve parents' infant sleep practices. As part of that study, research assistants used surveys to comprehensively assess parents' infant sleep practices, and the team compared it to what parents told their pediatricians.
In the first study, we did a baseline survey that systematically and comprehensively assessed their sleep practices for their infants. We asked things like during the day versus during the night, how they put their babies down to sleep, on their back, belly, or side, and what objects, if that was a crib or a bassinet or a pack and play, were there other objects in the environment? Were they sleeping with someone else? Those types of questions. We recorded the well baby visits with the pediatric residents to listen to how families talked to their pediatrician and how residents spoke with families about sleep. So our key takeaway from that first study was that pediatricians are not systematically assessing infant sleep practices when they're meeting with families. And without that, we are really unaware of what those practices are, and families can leave our office thinking that their sleep practices are safe when they really may not be. So in this new study, we are utilizing informatics using the electronic medical record and the infant sleep assessment that you'll hear about, as well as motivational interviewing training to help better assess and counsel on safe sleep.
The ISA is an elegant tool to aid residents in providing efficient safe sleep counseling. The ISA takes information that the family gives and then provides it to residents in a way that allows them to more efficiently and effectively counsel patients about safe sleep using motivational interviewing techniques. Residents are really pressed for time during these visits. And the idea behind the ISA is that it will allow a lot of the information gathering and high quality information gathering to occur prior to the visit, so that residents, when they arrive in the room, will get a digested, broken down summary of what patients and their families are doing regarding sleep.
The ISA is an 11-item screening questionnaire that parents complete prior to seeing their pediatrician. The ISA assesses safe and risky infant sleep practices for both daytime and nighttime sleep behaviors.
This is an intro to the use of the Infant Sleep Assessment, or ISA, in EPIC. 1 week before the 2-month-old visit at Harriet Lane Clinic, we will send the ISA survey to the family. Here, you can see the questions that the family will answer on MyChart. The survey is short and can be completed in under 5 minutes. 2 days before the scheduled 2-month-old visit, you will receive this email. It reminds you to use the 2-month-old ISA visit smart phrase as your note template, provides an alternative ISA-only smart phrase in case you want to use your own 2-month-old visit template, and includes a reminder about the AVS smart phrase. When you use the infant sleep assessment for the first time, a key task for you to complete will be to add speed buttons for the ISA research smart phrase and 2-month-old note template, as well as the ISA AVS. Do this by clicking the wrench above the note template and above the AVS. So you go to the patient list, select the visit, and begin to chart. Here is what the smart phrase will look like when you use it to populate the note template while pre-charting. Note that the ISA portion of the note is blank, except for the hyperlinks, as the family has not yet answered the MyChart ISA survey. We strongly encourage the use of this smart phrase as part of participating in the ISA trial. When the family arrives for the visit, study staff will double-check whether the ISA is filled. If the ISA was not completed, staff will sit with the family and have them fill out the ISA using a tablet computer prior to starting the visit. Study staff will send a reminder secure chat message to you a few minutes prior to the visit start time. It has another reminder to use the 2-month-old ISA visit smart phrase as your note template, as well as an alternative ISA-only smart phrase and the AVS smart phrase. Prior to going into the room, or when you enter the room, remember to refresh your note. When you refresh your note, you can see that the ISA now populates in your note with a summary of positive and concerning sleep behaviors. If you choose not to use the 2-month-old ISA note template to pre-chart, you can populate the ISA now with the ISA Results Only Research smart phrase, which only contains the ISA results. We strongly encourage the use of this smart phrase as part of participating in the ISA trial. Now you can proceed with your visit in typical fashion, including checking in with the family about problems and going through standard counseling and preventive care. When it comes time to talk about infant sleep, you can use the information in the ISA portion of the note. See that positive sleep behaviors are highlighted first. In motivational interviewing, it is recommended to begin by recognizing what parents are doing well. Concerning sleep behaviors are highlighted second. You can access a richer suite of tools by clicking the first hypertext link. When your preceptor goes to sign the note, the text in the brackets will disappear, reducing note bloat. See the positive and concerning sleep behaviors highlighted at the top. Below this, we provide a standard motivational interviewing prompt with sample dialogue. We strongly encourage the use of these motivational interviewing prompts as part of participating in the ISA trial, including Acknowledge a current safe sleep behavior. Ask open-ended questions about concerning result without judgment. Articulate your understanding of the family's perspective. Ask parent concerns and ask permission to share your concerns. Next, you can see the visuals for family education. Now we return to the note template where you can access the AVS Smart Set. Once you click Sign, you can see the AVS populates. We strongly encourage the use of the ISA AVS as part of participating in the ISA trial. As an alternative to populate the AVS, you can use the Speed button in the Patient Instructions section. Once you are done with the visit, you can forward the note to your clinic preceptor according to your usual workflow. Please remember, your tasks are to use the ISA Smart Phrase, remember to refresh, use the motivational interviewing method, and populate the ISA AVS.
Getting information from parents is one thing. Leveraging that information to reduce risky sleep practices and promote safer sleep is another.
Motivational interviewing is a communication strategy to help uncover a patient's own motivations to change. Using motivational interviewing techniques is really a way to efficiently use your time in a patient encounter. If you don't use motivational interviewing, you won't necessarily uncover where a patient is on the journey of their behavior change and what their motivations are. So you could spend a lot of time talking about something that's not relevant to that patient. The first step is to ask an open-ended question about the result without judgment. The next step is to reflect your understanding of the family's perspective. The next step is to ask about the parent's concerns. And the last step is to ask the parent's permission to share your concerns. One of the common communication pitfalls we see in behavior change discussions, and including safe sleep, is the reflex of providers to want to correct the patient immediately. So if I'm a parent and I say I'm putting my baby on their stomach to sleep, a provider might automatically say, don't do that. You should put their baby on their back. And that's just a natural human response when you hear something that you think is incorrect to try to correct it. But the impact that has on patients is to really silence any further discussion around why that's occurring and really invalidates their experience. So motivational interviewing helps people to avoid that reflex to right or correct patients by helping you have a standardized approach using open-ended questions, non-judgmental communication coming from a place of curiosity, which all helps the family and parents to be open to uncovering the true reasons why they might be engaging the behavior and potential motivations for them to change. We've provided an example scenario of how to use these motivational interviewing techniques in safe sleep counseling. Watch this role play and see if you can spot the motivational interviewing techniques in action. Well, thank you so much for completing the infant sleep assessment. I see that you're doing a really great job of putting her down on her back to sleep. So really excited to see that. I also see here, you notice that sometimes you're sleeping in your bed together. Can you tell me a little bit more about that?
I just think that she sleeps better when she's in the bed with me. She's close to me, seems to sleep longer, have longer stretches. And we have a bassinet and it's in the room, but I think that it's just uncomfortable. The bottom is so hard, and we bought another pad, but that's like really thin and flimsy, and it just doesn't seem comfortable for her.
I hear what you're saying. It sounds like you feel that she's more comfortable in the bed with you and that it's not very comfortable when she's sleeping in the bassinet on the hard surface. Do you have any concerns about her sleeping in the bed with you?
Not really concerns. I think that it's fine.
Well, thanks so much for sharing that with me. Would it be okay if I share some of my concerns about sleeping together in the bed? So, as you mentioned, you've been waking up checking on her, and sleep can be, unfortunately, a dangerous time for babies. And we do notice that sometimes with parents' bodies in the bed and also soft items like pillows and blankets, that it can put babies at risk for not having an easy time breathing or suffocation. So we, as pediatricians, we often say that the best place for a baby to sleep is alone on their back and in their own sleep space, like a bassinet. Do you think you might be open to try having her sleep in the bassinet next to you?
I would be.
Okay, great. Talking about sleep with families is really difficult. As pediatricians, we have a lot of evidence about unsafe sleep practices, and we feel strongly that babies should sleep in safe environments. But at the same time, families are going through a really difficult time with a newborn who's not sleeping very well, and they're exhausted, and often they're doing the best they can do. So often what happens is a clinician will ask questions, potentially in a leading way. For instance, your baby's not sleeping on their back, are they? And the parent knows what answer they're supposed to give. They were shown videos in the inpatient unit about safe sleep. They know what they're supposed to be doing. And so often we're setting up families to not feel open to discuss their real challenges around safe sleep practices. And the whole context of motivational interviewing is around behaviors that are often stigmatized. For instance, smoking, weight management, substance use. And having your baby sleep in an unsafe way is a stigmatized behavior and something that parents might not feel comfortable talking about. So if you use motivational interviewing techniques, you may put your families at ease to bring up behaviors that maybe they know are undesirable, but they're having trouble changing, and collaborate together on how to change those behaviors. Together, using the infant sleep assessment tool and the motivational interviewing techniques will result in more efficient and effective communication around safe sleep. Right now, we ask residents to spend a lot of time gathering data and then also counsel families about that data. The infant sleep assessment tool will save them time in that they'll already see the data there for them to review with the family, and the family can input it into a computer screen where maybe they don't feel the judgment around their unsafe sleep practices. And so we hope the residents will see accurate, effective, efficiently gathered information at the start of their visit that allows them to target their counseling to the most unsafe behaviors. I'm really excited to see this sleep assessment tool as well as the motivational interview training incorporated into our clinic. As a preceptor, I see that this is a tough topic for residents to discuss with parents. The parents often know the answers they're supposed to give, the residents know the answers they're supposed to receive, and I think about half the time we don't hear about the unsafe sleep practices at home, and about half the time we do hear about the unsafe sleep practices, but our counseling is very directive and doesn't really uncover the reasons why a family might be doing those unsafe sleep practices. So I'm really excited to develop this efficient tool where residents and providers will be able to quickly get at the issues that families are having and use an empathetic, curious, patient-centered approach to help families develop solutions to those issues.
We know that a lot of times pediatricians may not raise concerns because there are barriers to getting resources. Well, fortunately, because of this study, we do have additional resources we can provide to families. That includes pack and plays for a safe sleep space, alternatives to using blankets, like a sleep sack, and pacifiers, which continue to be recommended by the AAP for safe sleep. Thank you again for watching this video. We know you may never feel there's enough time to talk about sleep practices during visits, that sometimes families face particular challenges with putting their babies to sleep safely. And we hope that you'll always feel confident and comfortable using the ISA and the motivational interviewing techniques we taught you today.